Hello everyone, I am Sahil Kedari from Team Code Miners and our project topic is Medicare. So let me start by what Medicare is. Medicare is intended to be as a platform for patients, doctors, hospitals and all the Medtech and Healthtech organizations where all the patient's data can be stored and accessed as and when required, thus preventing the patient's privacy and unauthorized use of their data. So in Medicare, we have four roles or four entities. So the first entity is the patient who has to log into our website. The second one is the hospital. The third is the research organizations who require patients' data for research purposes. And the fourth one is insurance, like insurance companies who provide facilities to patients. So now let's just go through them one by one. So to save the time, I have already registered using a user, a research organization, and an insurance company. Now let me start with research, registering as a hospital. So yeah, as you can see, this is the pop-up. So that means that I haven't registered yet. Also, we have used Polygon to deploy our smart contract on it, and Polygon to store the records that like patients' data, etc. So now I have registered. So as you can see, the MetaMask pop-up is here, and as you can see, the transaction is being done in Matic. So let's wait for the confirmation. So as you can see, the transaction is successful, and we have been registered as a hospital. Now let me just share you the user profile before creating a new record. So as you can see, the we registered with the hospital Ayush and it's visible here. And in the past history, as you can see, it's empty for now. So any records haven't been created. So now we can just create a record using the hospital that we registered. So we click on creating a new record and now we require patient's address. So let's take it from here. So we need a medical report for the patient and some tests, for example, blood test. Now let's create the new record. So the transaction is successful. So as you can see, I created a patient report and we can view that report. So as you can see, this is the sample report that I have added. And yeah, so now let's check from the user's perspective that can he see his record or not. So in the past history of the user, you can see that he has report that was created by the hospital has been reflected here, and he can view the report here as well. So now let's jump to research organizations. As you can see, there is not a single organization as of now. So let's log into the research organization. So let's start by creating a new research, for example, cancer research. Let's choose a poster image and the minimum number of users. So this users is taken because for example, if the research needs data of 50 lakhs patients, so all those patients who submit their records will be provided with Ethereum in exchange for sharing their records, and only the first users who fill like only the users required minimum number of users required will be provided with those Ethereum, and any users who give the record after that minimum required users, they won't be recorded. They won't be rewarded. So in this way, we are benefiting the patients as well. So as you can see, the transaction is confirmed. And this is the research that we have created, cancer research. Now let's view the research. So all the details are given here. And for now, there is not a single user document. So now let's see from the user's perspective, he can see the research or not. So in the researchers tab, as you can see, the cancer research is seen here, and the user can grant the access of his documents to that research. So let's do that now and see. So we have, let's wait for the transaction confirmation. Similarly, one the user can also revoke the access to his documents, and the Ethereum would be deducted from his account, thus ensuring that no extra Ethereum is being lost. And as you can see, now the button has changed to remove access. So that means the access to user document has been given to the research organization. As you can see, the patient Ankit, doctor name Ankit Jaiswal, and this patient report that was created by that hospital is now now the research has access to this report, and he can view this report and conduct his research as well. Now the fourth entity that we have is the insurance for insurance companies. As you know, like in hospitals, whenever a patient is needed in terms of whenever there is emergency, insurance is what comes to their care. So as you can see, I have registered using the organization Policy Bazaar, and this is the profile. So let's see if the user can see this uh, insurance organization. So in insurance tab, as you can see, the newly created insurance organization is here, and he can grant access to his documents so that the insurance company can review his documents and see if it's genuine or not, and provide him benefits in terms of the insurance. So let's grant access to the insurance company. So Medicare is a platform for patients, doctors, hospitals, and medtech and health tech organizations, where all the user data is stored safely and securely, as well as the patient's privacy is protected. We have used Polygon to deploy our smart contract on that, because Polygon's facilitates smarter, cheaper transactions, thus benefiting the usability of our product. We have used Filecoin or IPFS to store the patient's record as well. So for our feature scope, we have decided to add labs as an entity to our platform. Labs are those entities who take blood reports, CT scan, etc. All those medical reports would be taken by those labs, and then those reports would be sent to the hospital directly without any middleman. So in this way, this would be benefiting the patient a lot. So that was it for our project Medicare. Thank you.